we've vaccinated more than 100,000 people, or more than 100,000 vaccinations have been given across our community. Additionally, according to the state data, we lead the big 4 metro counties in percent of population vaccinated with both doses. We are thrilled that more and more people are getting this much needed and much desired protection. This wouldn't be possible without the strong partnerships between KCHD, our regional hospital systems, many other healthcare systems or healthcare providers across our community, and the state of Tennessee, who also helps coordinate vaccine allocations. So we want to extend our gratitude to all of those groups who play a role in getting all of you vaccinated. Now, I'd like to spend a few minutes talking about vaccination efforts through the health department. To help explain our role, I'll break it into 3 sections: vaccinator, partner, and facilitator. First up, our role as vaccinator, one you're familiar with. We continue to offer vaccination opportunities through the health department every day. For first doses, we utilize our wait list to reach out to eligible individuals and get them scheduled for an appointment. These first dose clinics can all look a little different. For example, sometimes these vaccination opportunities are all-day large-scale clinics, such as those that we offered at the Expo Center and will soon be offering at the Broadway location. Other times, when we have smaller number of vaccines, maybe 50 doses or so, we hold smaller opportunities right here at the health department. Additionally, we sometimes go to specific locations to provide vaccines for groups that we have a responsibility for vaccinating, as we did for those living in congregate settings with developmental or intellectual disabilities. For all of these first dose opportunities, we schedule corresponding second dose opportunities. These either have to be held 21 or 28 days after the first dose, depending on which vaccine was given. This requires significant planning to ensure that every time we offer a first dose, we have the space and resources available to offer the second dose in that preferred time frame. In addition to the vaccination efforts done solely through the health department, we also work with community partners to vaccinate those at high risk without access. For example, last week we partnered with KCDC to offer vaccinations at 3 of their facilities. Additionally, we have worked with a few of the senior centers to offer targeted vaccination opportunities for those who are more medically fragile. In addition to our role as vaccinator, we also embrace our role as partner. Within this role, we regularly work with organizations in our community to increase education and offer vaccination opportunities. Example of this would be the partnerships we have established with the Faith Leaders Group and other organizations in our community that are dedicated to minority outreach. We have lent support to several of these organizations as they work to ensure vaccines are offered and provided to the minority communities in Knox County. The third component of our vaccination efforts is the role of facilitator. We regularly work with organizations to assist them in their vaccination distribution. While we are not directly administering the vaccine in these cases, we help support these organizations by providing vaccine and vaccine management to partners who want to hold vaccine events. We served in this role to help support the University of Tennessee and Summit Medical Group before they were activated by the state of Tennessee to receive vaccine. They have both now been activated and are actively receiving vaccine through the allocation program through the state and through the county. Additionally, we coordinate with organizations who've been activated by the state to receive vaccine. These organizations tell the health department how much vaccine they want to receive for a week, and we work to coordinate these requests, fitting them into the total allocation for the county, and then share that breakdown back with the state, who then makes that order. The state ultimately makes the final decision in allocation. The bottom line is that this is a reflection of public health at its core. Outside COVID-19, we wear many hats and work with many organizations. In our vaccination efforts, we are working every day to provide more vaccines to those in our community, whether that's as the primary vaccinator, a partner, or a facilitator. Sorry about that. We know that the demand for this vaccine is continues to outpace the supply, but we are encouraged by the progress we're making as a community. With today's news of more than 100,000 vaccines administered in Knox County, nearly 14% of the population has some level of protection. While we still have a ways to go, it is extremely encouraging and is likely one of the reasons we are seeing a lower burden of disease across our community. Our efforts are working. That said, we want to continue to remind everyone to keep following the 5 core actions. While we are heading in a hopeful direction, we don't want to give an opportunity for this virus to spread further, and letting our guard down on the 5 core actions would be just that. For an updated look at vaccine numbers across the county, you can check our vaccine information page. We will be updating the data every Tuesday and Friday. On this page, you can see more than 101,000 vaccinations have been given in Knox County. Here at KCHD, we've administered 20,000 of those vaccines. Now moving to the local situation. We have 53 new confirmed cases since yesterday, 1,340 active cases. 55 Knox County residents are currently hospitalized. And sadly, we have an additional death to report today, raising our total to 537. So I will now open it up for questions.
All right, for our media partners that are in the Zoom chat, you can go ahead and submit your questions. From Austin with WATE, with the Johnson & Johnson vaccine becoming available soon, will Knox County switch to the 1-dose vaccine?
So some allocation of Johnson & Johnson, I'm sure, will be available through the state. And the state is providing some guidance on who best to get that vaccine. So we do think that providers in Knox County will have the vaccine, but I think we'll continue to see Pfizer, Moderna, and Johnson & Johnson adding that to the list of potential vaccinations available for folks who live in Knox County.
Also from Austin with WATE, it's the first week of March. If I recall, you said the Food City site could be ready to go this week. Where are we in the progress?
Well, our current timeline has shifted just a little bit. We will be able to take occupancy of the building on March 8th, and then we'll start operations there on March 12th. So that's our current plan. There were some delays in just process and getting things ready. Anybody who's moved into a new place knows that things sometimes have to be cleaned up and reorganized and things like that. So we're very hopeful that we'll be able to get started vaccinating people that were March 12th, but in between now and then, we'll be vaccinating people here and in other locations.
From Alan with Inside of Knoxville, what are the current plans for immunizing Knox County teachers?
As we said before, our hospital partners are helping us get our Knox County teachers vaccinated, and that's private schools, public schools, and childcare as well. And it's all the staff, it's not just teachers. So anybody who works in schools or childcare is eligible for vaccine under the current state plan. And our hospital partners are working closely with us to get those folks vaccinated, and we're very grateful for that. Obviously, anybody who's in education or childcare can certainly sign up on the wait list and put their name there as well to await opportunity to be vaccinated.
From Grace with WBIR, any word on when the Johnson & Johnson vaccine will arrive in Knox County or how much will be allocated?
Well, first of all, the allocations don't get broken down by vaccine type. We submit a request. We can say that we prefer to get a specific type of vaccine, or that provider would prefer to get a specific type of vaccine. And the state generally will honor that if they can. I don't know what the allocation of Johnson & Johnson will be for the state. And again, allocations at the county level are not broken down by type. We do anticipate receiving some Johnson & Johnson vaccine, and providers who receive that can choose how they would use that.
From Allie with Knox News, how much of Knox County's vaccine allocation have providers administered?
So all of the allocation gets distributed to providers, including us, and each of those providers uses that allocation within a week or two. Over time, 100% of the allocation gets used.
Yeah, and also, and I'm not sure, Allie, if this is what you're looking for too, but on our website, on the data page, you can also see how it's broken down between public health and other providers. I'm not sure if that's what you're looking for either, but that might be helpful. From Grace with WBIR, spring break is approaching soon. What's your guidance to families trying to make plans for that weekend? And what's your message to people planning on coming here?
So the 5 core actions apply no matter where you are, whether you're traveling for vacation. COVID doesn't take a vacation. COVID numbers are down. Fortunately, COVID numbers are down across the country, which is very encouraging, but does not negate the need for the 5 core actions. So if you're coming here to visit in Knox County, be ready to practice the 5 core actions while you're here and take precautions as necessary. Certainly don't travel if you're not feeling well. If you've been exposed to COVID, you need to be tested and I might want to reconsider traveling. Getting a test before you leave doesn't guarantee that you won't contract COVID while you're gone, or you weren't incubating COVID while you were tested. So testing isn't a really good, reliable way to know that you're not. Testing tells you that you don't have COVID right now. It doesn't tell you don't have COVID tomorrow. So that's important to remember. But I think the most important thing is practice the 5 core actions. Preferably travel with your family, with people from your household. And don't travel with people outside your household. And I know that's hard to do. People don't want to do that. But that's a way to keep yourself and your family and your loved ones safe.
From Allie with Knox News, when phase 1C is added to eligibility, how will people prove they have chronic conditions that qualify them?
We have not been asking for any documentation. We've vaccinated folks who have disabilities. We haven't asked for documentation on that. We won't be asking for documentation on medical conditions. We'll just have to trust folks to be honest and not jump in line ahead of other folks.
From Austin with WATE, with the milestone in vaccine distribution, 100,000 overall, what is your view of Knox County's progress?
I'm pleased with our progress. I think we're doing a really great job. I think, we've really demonstrated greatly as a community how to use the public health system to address a public health issue. The public health system is not just us, it's hospitals and doctors' offices and pharmacists and groups that work with minority populations and service providers and you, the public. You're waiting your turn to get vaccinated. So everybody's doing their part so that folks at most at risk can get vaccinated. And I'm pleased with that.
Austin had 2 follow-up questions as well related to that. He asks, what has the health department learned and how do you think KCHD has done in becoming the leader of the Big 4?
So, what we've learned, and I don't know if it's learned, but we maybe re-emphasize how important our partners are. There's no way we could have gotten to 100,000 without our partners. Knox County Health Department alone could not have done that. And so we are so grateful for the partners that we have who are helping us get people vaccinated every day and opening up those opportunities. And there are even partners that we have that are vaccinating folks in Knox County that we don't allocate vaccine to. I'm thinking Kroger's has been activated. I think Walmart's been activated. They're vaccinating. So that's through the federal partnership as well. So I think we've done a great job. I think we've just been persistent. We're not, persistently getting the vaccine out there, emphasizing to the providers in our community that they really need to use the vaccine within about a week or 2, preferably within a week. And and we've been doing the same here, getting our vaccine out when we get it.
From Claire with WUOT, how many vaccine doses did the Knox County Health Department request from the state this week, and how many doses is the county receiving?
I don't have that information off the top of my head, and we haven't made our request yet this week. We don't have to make it till tomorrow. So I don't have that answer yet either.
Also from Claire with WUOT, can you explain what metrics and factors you take into account when deciding which independent pharmacies and clinics to distribute vaccines to?
It's mostly based on state activation. So the state makes a decision to activate a particular pharmacy, and then they're eligible to receive vaccine. But then when we look at medical providers, we're also asking, and the pharmacies, they all have to be willing to vaccinate the general public, not just the people they serve every day or not just their patients. And they're all willing to do that. And again, grateful for that partnership, grateful for their willingness to do that and vaccinate not just their patients and not just the people they serve, but the general public.
From Allie with Knox News, are people still not able to choose which vaccine they prefer? And do you think this will be a possibility as supply increases?
There's really no need to choose a vaccine. All the vaccines are very effective. The Pfizer, Moderna are more than about 95% effective. The Johnson & Johnson vaccine is about 60% effective, which is actually more effective than the flu shot most of the time. So just take that in consideration. And it's 100% effective in reducing severe disease, hospitalization, and death. So those are the things we want to prevent. So there's really no reason to choose which vaccine. But if you do want to wait and choose, then you're going to have to wait until vaccine supplies are flowing more readily.
From Grace with WBIR, any updates on how long KCHD's waiting list currently is? And how would you describe the current demand for 1B and 65 and up?
So the current wait list has a little over 22,000 people on it. What we know from experience is sometimes those folks have already gotten vaccinated. Sometimes those folks, things change. So, we 22,000 is the number, but once we reach out to those folks, sometimes we learn that they don't need vaccine anymore. So that's encouraging. We're happy when that happens. We're also happy when we get somebody an appointment. There was another part to that question that I forgot.
How would you describe the current demand for 1B and 65 and up?
Demand continues to be really high. We've stayed right around 20, a little more than 20,000 on the wait list for a while. So that tells us demand continues to be high.
From Brian Hornback asking if KCHD is no longer receiving Pfizer per KCHD's request.
As we stated previously, I had a conversation with Dr. Fiskus at the state level, who's over the immunization program. And at the time, she had quite a bit had Moderna available, and we chose to start receiving Moderna in part because we can store it here. It's a little easier for us to manage. And so it was completely our choice to do that. It was not about any incident. It was about, she had Moderna available. I actually asked if it would help her out if we started taking Moderna, and it actually did help her move some Moderna to a place where it could be given. In addition to being easier to store, Moderna also comes in 100 per package, or per tray or whatever, which makes it a little bit easier for us to go off site and do an event. You don't have 975 doses you have to make sure you're going to give. So we may be switching back to Pfizer. The supply ebbs and flows, and depending on what the supply is, we may switch back to Pfizer. Our staff is very comfortable with either vaccine.
Any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come in. So thank you all for your time today, and we hope you have a great and safe rest of your day.